What if I told you that one small habit you repeat every single day, often without thinking, could be quietly signaling serious health issues developing in your body after 60? I know that sounds too simple. You're probably thinking, Doctor, I've been dealing with health advice for decades. If it were that easy, someone would have told me already. And honestly, I understand that reaction completely. Because by the time you reach your 60s or 70s, you've already tried the supplements. You've changed your diet more times than you can count. You've listened carefully to every piece of advice from friends, family, television doctors, and the internet. You've done what you were told. Still, things don't feel quite right. I'm Dr. Helen Morris, and over the past 25 years working with adults over 60, I've seen one overlooked daily toilet habit correlate with up to a 30–40% higher risk of serious health complications when ignored. And the most troubling part? Many of the people affected were doing almost everything else right. I see patients in their late 60s and early 70s who walk every day, take their medications exactly as prescribed, watch their sugar, limit salt, and go to every checkup. Still, they feel exhausted. Still, they worry. Still, they sense that something in their body is slowly slipping out of balance. They tell me they're tired of being vigilant, tired of tracking numbers, tired of spending money on solutions that promise relief but deliver nothing lasting. And they're scared because deep down, they know something isn't adding up. If that sounds familiar, stay with me. Because what I'm about to explain may change how you look at one of the most ordinary moments of your day. Before we go any further, I'd love to know where you're watching from. Please comment your country or city below. I read those comments personally, and it helps me understand who I'm speaking to. And let me be absolutely clear about something critical right from the start. What we'll discuss today is not about replacing your medications or ignoring your doctor's advice. This is about supporting your body so that everything you're already doing can work better, not harder. Now let's talk about what's actually happening inside your body as you age. After 60, several physiological changes occur that most people are never fully told about. First, your digestive motility slows down. That means food moves more slowly through your intestines, giving your body more time to absorb water from stool, often leaving it harder and more difficult to pass. Second, your thirst sensation diminishes. Even when your body needs fluid, your brain doesn't send the same strong signals it once did. You may think you're drinking enough, but physiologically, you're often behind. Third, your pelvic floor muscles naturally weaken with age. This affects not just bladder control, but bowel movements as well. Straining becomes more common even if stools appear normal. And here's the overlooked factor that most people, including many healthcare providers, completely miss. The timing and posture of your bowel movements matter just as much as frequency. Even mild occasional straining, just a few minutes each morning, can create measurable increases in blood pressure, stress hormone release, and inflammation. Over time, this can impact cardiovascular health, worsen hemorrhoids, aggravate diverticular disease, and even affect blood sugar regulation. Now, let me tell you about Gerald. Gerald was 68 when he first came to see me. He sat down in my office, leaned forward, and said, "Dr. Morris, I don't understand what I'm doing wrong." He was taking his medications perfectly. He ate oatmeal every morning, vegetables at dinner, walked 30 minutes a day, and tracked everything in a little notebook. Still, every morning felt like a battle in the bathroom. His wife, Linda, added quietly, "He's in there forever, and when he comes out, he looks exhausted. Sometimes dizzy." I asked Gerald a simple question. From the time you wake up to the time you use the toilet, how much water do you drink? He paused, thought for a moment. "None," he said. "I go as soon as I wake up." That was the moment everything changed. Gerald was going nearly 9 hours overnight without hydration, then asking his body to perform a complex physiological task immediately upon waking. His colon simply wasn't ready. We made a few simple, strategic changes, nothing dramatic, nothing expensive. He began drinking 350 milliliters of room temperature water within 5 minutes of waking. He waited 10 minutes before sitting on the toilet. He adjusted his posture slightly, feet elevated about 15 centimeters. 2 weeks later, he called me. His voice sounded different, lighter. "I honestly thought you were a little crazy," he said, laughing, "but something's changed." After 1 month, his straining was down by nearly 60%. His morning blood pressure readings dropped by an average of 8 points. And most importantly, he said, "I don't dread mornings anymore." Before I teach you the specific method we used, let me explain the 3 most common mistakes I see. Mistake number 1, forcing timing. Many people believe they must go at the same exact time every morning, no matter what. Think of your digestive system like a river. If the water level is low, forcing flow creates turbulence and damage. Waiting just a few minutes for hydration can make all the difference. Mistake number 2, ignoring posture. Sitting flat-footed on a modern toilet is like trying to pour water from a bottle while holding it sideways. Elevating the feet slightly straightens the rectal angle, allowing gravity to help instead of hinder. Mistake number 3, chronic low-level dehydration. Not extreme dehydration, just enough to slowly harden stool over time. Scientifically, even a 1–2% fluid deficit can significantly alter stool consistency. Now let me introduce you to the method I use with nearly every patient over 60. I call it the FLOW method. F stands for fluid first. Within 5 minutes of waking, drink 300–350 milliliters of room temperature water, ideally around 22–24 degrees. This gently activates the gastrocolic reflex and rehydrates the colon after overnight fluid loss. L stands for light movement. Spend 5 to 10 minutes moving, gentle walking, light stretching. This stimulates intestinal motility and signals your body that it's time to transition from rest to activity. O stands for optimal posture. When you do sit on the toilet, elevate your feet 10–15 centimeters, lean slightly forward, relax your abdomen. This reduces straining and pressure dramatically. W stands for wait without force. If nothing happens within 5 minutes, get up. Do not strain. Try again later. This trains your body without stress. Let me tell you about Margaret, age 72. Margaret came to me worried because her A1C had been creeping up despite no changes in diet. She also mentioned feeling off every morning. We started with just one change, fluid first. 3 weeks later, she said, "I feel genuinely different, lighter, calmer." 3 months later, her A1C dropped by 0.4 points. Her endocrinologist was surprised. Now, how do you implement this practically? Aim for at least 1 liter of fluid before noon. Use a reusable bottle. Place it by your bed as a visual reminder. Expect some adjustment the first week. By week 2, many notice easier mornings. By week 3 or 4, the change becomes automatic. I often hear patients say, "Doctor, I just feel genuinely better." Not dramatic, just better. Let me be absolutely clear about something critical. This is not a replacement for medical care. Do not stop medications. Continue following your doctor's plan. If you have kidney disease, heart failure, or are on fluid restrictions or blood pressure medications, speak to your physician before making changes. Finally, I want to tell you about Robert. Robert was 74 and had lived with digestive issues for nearly 20 years. He felt like he had completely failed his body. He'd tried everything: laxatives, fiber, cutting foods. Nothing worked. He feared things would only get worse. His habits were harsh, straining, rushing, ignoring thirst. When he adopted the FLOW method fully, something shifted. 3 months later, he sat in my office with tears in his eyes. "You gave me my life back," he said. "I wish I'd known this years ago. So I want to challenge you personally. Try this for 21 days. Drink the water, move lightly, adjust posture, do not force. Track how you feel, comment your results. If you made it to the end, type FLOW below. Tell me your biggest struggle. Share this with someone you love. Remember, small strategic changes implemented consistently create genuinely measurable results over time. This is Dr. Helen Morris, and I'll see you in the next video.